Dr. Brightman.
And I'm Dr. Jocelyn.
And we study the brains and parts of the brain to show why those parts of the brain work and what they help with.
Today we're going to be talking to you guys about a zombie virus that has been going around.
And we're going to show you and demonstrate why people become zombies.
And what they do.
This disease starts in the frontal lobe of the human brain. It destroys the frontal lobe and it causes the human to use their conscious thought, voluntary movement, and individual personality. Damage to this vital lobe causes impairments in judgment, attention span, and organizational ability, as well as loss of motivation. The frontal lobes are in charge with the task of regulating mood and emotions. Consequently, when they are compromised, a patient may become impulsive, act rashly, and adopt risky behaviors such as substantial abuse.
Hi, I am going to be talking to you about the second stage. The parietal lobe is the control center of the brain, located at the back of the head directly under the skull bone, and at this point is where they start losing their form of moving properly. The parietal lobe assists in the processing of visual imaging and other sensory inputs. This is the part that sends urgent messages to your muscles to move. A person most likely having difficulty reading, recognizing people and objects. Also having a comprehensive awareness of his or her own body and limbs and their positioning in space. They also have a hard time recognizing from left to right.
The zombie disease happens in the temporal lobe, which is on both sides of the brain hemisphere. This is responsible for the primary organization of sensory input, and when infected by the zombie virus, the zombie experiences disturbance of auditory sensation and perception, and inability to pay attention to what they see or hear, impaired ability to comprehend language, impaired factual and long-term memory and emotional disturbance, and altered sexual behavior. They also have seizures, lose their sense of humor, and become obsessive.
Stage 4, occipital lobe. When you look at a clear sky and are able to discern its blue color, you are using the occipital lobe. Located at the back of the brain, occipital lobes are responsible for visual perception. When infected, results in loss of visual capability and inability to identify colors and hallucinations, also blurred vision.
Stage of the virus is the brainstem damage, where it causes severe injuries that are classified by major classification and mental functioning. A prolonged state of unconsciousness or coma, the persistence vegetation state or minimal responsive state. When this part of the brain is infected, it affects the spinal cord, which is why the zombie moves the way it moves, and its body moves differently. After going through all these stages, the skin starts to deteriorate and look dead-like, and this is why the zombie looks the way they look. Oh my gosh, what happened?
Symptoms include gastrointestinal issues, including nausea,
Stage
constipation,
of
and
the
diarrhea, because most drugs
virus
go
is
through
the
the digestive
brainstem
system to be absorbed.
damage,
Other common
where
after
it
effects
is a
include
severe,
drowsiness, pain,
it
and
causes
skin
severe
reactions.
injuries that are classified by major classification and mental functioning. A prolonged state of unconsciousness or coma, persistence, vegetation state, or minimal responsive state. When this part of the brain is infected, it affects the spinal cord, which is why the zombie moves the way it moves, and its body moves differently. After going through all these stages, the skin starts to deteriorate and look dead-like, and this is why the zombie looks the way they look. Impaired ability to comprehend language,